In the previous tutorial, we discussed the regions of the vertebral column and the structural features of the vertebrae. The goal of this tutorial is to recognize the vertebrae from different regions of the spinal column. So let's review the important features of the vertebrae. On the anterior side of each vertebra, we have the body. And then you can clearly see the vertebral foramen, which is a hole that houses the spinal cord. And projecting from the posterior side of each vertebra is the spinous process that you can palpate through the skin of your back. Then each vertebra has two lateral projections, which are the transverse processes. In general, the vertebrae are smallest near the skull and then become gradually larger as you move inferiorly through the body. This is because the inferior vertebrae need to bear more of the weight of the body. Keep in mind that there's no discrete cutoffs between the features of vertebrae in different regions. The vertebrae at the transition of two regions share some structural similarities with adjacent vertebrae from another region. What we'll show you in this tutorial are ideal examples of vertebrae from each region. Before we start, take a moment to look at these three vertebrae and determine which one is cervical, thoracic, and lumbar. From left to right, these are a cervical, a thoracic, and a lumbar vertebra. Let's talk about some of the features that distinguish the vertebrae from the three different regions. First, we'll look at the vertebral body. In the cervical vertebrae, the body is relatively small in comparison to the foramen. In the thoracic vertebrae, the body is larger and it's somewhat heart-shaped. In the lumbar vertebrae, we see the largest, most massive vertebral bodies. And this makes sense because they bear the most weight of the body. Next, let's take a look at the spinous processes. In the cervical vertebrae, you can see that the spinous process is bifurcated. In the thoracic vertebrae, the spinous process is usually thin, and it's projected inferiorly at an angle away from the body of the vertebra. In the lumbar vertebrae, the spinous process is thick, and it projects dorsally at about 180 degrees from the body of the vertebrae. The thick spinous process of the lumbar vertebrae provides extensive surface area for attachment of the inferior back muscles. Finally, one feature that's unique to the cervical vertebrae is that the transverse processes of the first 6 cervical vertebrae contain a prominent, round, transverse foramina. The transverse foramina are passageways for arteries and veins that supply the brain. Finally, the most inferior region of the vertebral column is the 5 fused bones of the sacrum and the 4 fused bones of the coccyx. In addition to the bones we discussed in this tutorial, you should also be able to recognize 2 specific cervical vertebrae, C1 and C2, which are also known as the atlas and the axis. Please be sure to read about the atlas and the axis in your histology text and to look at their unique features in the lab this week. If you have any questions about this tutorial, be sure to ask them on the discussion board for this module.